Hi, and welcome to Visibility Unlimited and Visibility Unlimited Spotlight, the video portion to the podcast, Visibility Unlimited. I'm Leslie Short, your host and the owner of the Cavu Group. You know, I love all of my conversations. This one is so timely and so important because in our society now, all we keep hearing about is healthcare and insurance and healthcare and insurance. And my guest today, Cynthia Overton, correct?
Overton.
Overton,
But
PhD.
No, but overtone sounds so sophisticated. So
Oh,
I'm open to that also.
everyone knows I am the worst with pronouncing names, and I practice in my head, and I still. But welcome, Cynthia. Thank you for joining me today.
Thanks for having me, Leslie. I am so excited about this conversation. I have been looking forward to it.
And listen, I know you have written a book, and we are going to get into that, but I'm taking part of the title as the title of this podcast, which is Shaping the Future of Healthcare Through Person-Centered Care. That's part of your title.
Yes.
And with the conversations on insurance or lack of insurance or the how the skyrocket, I haven't spoken to anyone that hasn't said their health insurance hasn't gone up $100 to thousands of dollars. So when you say, self-person centered care, what does that mean to you? What is that?
Right. That's a really excellent question. I'm so glad that we're starting the conversation with what is person-centered care. So first of all, I just want to start off by saying it is my opinion that healthcare is really designed for systems and to accommodate systems, not people.
I agree.
And what I want healthcare to do is to meet the needs of the people that are on the receiving end of care to, of course, improve health outcomes. So when we think about what is person-centered care, I like to start off by kind of thinking about, well, what is traditional care? Right. So traditional care is the doctor asks you what's wrong, you tell them what's wrong, they tell you what to do, you go on your way. Now, a lot of people really think about building on traditional care with patient-centered care, which is a little bit different from person-centered care. Patient-centered care, there's still a conversation involved in terms of, what's happening, what can I help you with? The patient, on the other hand, really gives their input, their opinions, and then a decision about care is made. When we think about person-centered care is a conversation, you think about a conversation with your healthcare provider, but there's also the consideration of the context. What's happening outside of the clinic that is going to impact what your goals are, what your needs are, and that, of course, determines whether or not you're going to follow a plan. You want a plan that's designed for you and for your life. And so when you're thinking about the whole person outside of the clinical setting, you're moving towards person-centered care. So I liken it to kind of like the evolution of television. We've got network TV, one size fits all. That's traditional care. Then we got cable. Cable, you've got more options, right? But you're still bound within a system. That's patient-centered care.
Right.
Then we've got the streaming era,
Pick what you want.
on demand. It works for you. You really get to think about how this fits into your life. Streaming era, that's person-centered care.
I love that. I think everyone can really understand that. I want to take one step further, though. Before you get to the person-centered care, work with me here.
Okay.
I think you need to have interpersonal conversation care. What do you wish for your income, for your outcome? Well, like, what do you want? Have you done research, not to the point of Google? I know my doctors be like, okay, let's see what the Google. I'm like, listen, I have to be educated enough to come in to know what other questions to ask so that I don't get I came in, you tell me what's wrong, I go home, and then I still have 15 questions.
110% person-centered care really does rely on you as an individual understanding what your goals, your interests, your needs are, and your ability to clearly communicate that to your provider.
And if you can't, then bringing that person with you that can help you. Because let's be honest, and I know we're going to get into this because, and I know it's in your quote, and I have a whole thing on advocacy, but
Mhm.
being able to communicate when you're trying to listen,
Mhm.
write, maybe record if they allowed, all of that kind of goes, you only catch half. You know, whenever I do workshops and people are writing so much, I'm like, stop writing
Yeah,
because you
yeah,
can't hear what I'm saying and you can't digest it because
yeah.
you're so busy trying to catch pieces of it. And
Right,
I think
right,
that's
right.
the same way when you're in a doctor's office. You you're trying to get as much as you can, but everything you don't hear everything.
110%. And I mean, I think about myself in terms of when I go to the doctor now, I do go with a notepad. I try to, listen, jot down, but listen while I'm jotting down. I would say my annual checkups, given where my health is, I'm pretty healthy now, pretty much routine. And, a notepad and a pen works for me. Would I like to bring in a recording device? That would be helpful, but that also makes providers very uncomfortable.
Very much
E-
so.
Even though there's a trend in terms of now providers recording the conversations to help with charting, which I actually support,
Yeah.
it would be nice if it were, both ways. However, that's another conversation.
That is
But I will say that when I talked about this in the book, when I was, going through a very serious and complicated health ordeal, there is no way I would have been able to handle any of this by myself. And I was very fortunate in terms of having my family that was able to come in, advocate with me, take notes, do follow up. So, yes, to your point, the role of a support system is so crucial in health.
So then let's go back a step again.
Mhm.
What makes you an expert to write this book?
Ooh, on person-centered care.
Yes.
Yeah. So, I mean, in addition to my, I've got a background. I'm a social scientist by training, so I'm pretty good when it comes to doing the research and understanding. I also have been considered by many as an expert in knowledge translation, which is taking dense medical healthcare research and synthesizing it into bite-sized pieces of information that people will understand and actually want to either read or, watch a video of. But then, my personal experience. And I think that that's really what you're getting at.
Yes.
When I was 26 years old, I was living my best life. I didn't have a care in the world. I was young. I was cute. I was all that. You couldn't tell me
Okay.
anything, okay?
Right.
Nothing. And then, excuse me, went through this period where I just had all of these strange symptoms like brain fog. My fingers stopped working properly. I would like literally have to unclutch my or let go, release my fingers with my other hand. I would go through periods of dizziness where I knew what was going on around me. It was like brain fog, but I couldn't move. All these just very strange symptoms. And, I went to the doctor. They, did all these different tests, stress tests, heart monitor, this, that, the other. They didn't find anything. And then one day, my left foot stopped working.
Mm.
And so I had no idea what was going on. I was like, oh my gosh, somebody told me that he knew somebody that had that and they had to have leg surgery. I was like, oh my gosh, I don't want to have leg surgery.
Right.
So I go back to the doctor and the doctor sees me walk and she says, you have to go to the hospital now. And again, I was young. I was like, well, I can't go now because I got a hair appointment
I have things to do.
after I leave here. I said, but Friday
That's
might work,
me.
right? Because this was like a $50 cancellation fee. So she was like, you don't understand. We could be dealing with a stroke. You have to go to the hospital now. And so I went to the hospital, checked in. It was almost like checking into a hotel. checked in and they did all these tests, and the doctors found a lesion in my spinal cord. Now, I was told that it was one of two things. It was either something called an arterial venous malformation, AVM, which is like a whole bunch of blood vessels wrapped up inside of your spinal cord that, with me, hemorrhage, which caused the foot drop, or it was a tumor and it could have been cancerous. So we literally did not know which one it was until the operation, and I needed to have it removed. Now here's where, kind of the unexpected part came in, and that was kind of like dealing with everything administratively. So I was in the first hospital for a week. My insurance covered it, no problems there. The issue was the doctor that diagnosed me, who was an amazing physician. However, he only did 4 of these surgeries a year. Now,
Yeah.
I don't know, how much folks know about the spinal cord. People often associate the spinal cord with, walking and, mobility, and that's true. But
Right.
it does so much more than that. It can
Connects everything.
yeah, exactly. I always say
Simply
that.
put, you need your spinal cord.
Exactly. The reach is huge. I always say that if
Right.
Beyonce was a body part, she would be a spinal cord
Okay.
because, large reach. So, we really did not feel comfortable with somebody who only did 4 of these types of operations a year to perform the surgery. We went, found another doctor in the state, and I was living in Michigan at the time, who did 10 of these surgeries. He really wanted to do the surgery. But 10 just wasn't, that number
Wasn't
that
the
we
number for you
needed.
still?
Right, right.
Yeah.
So my sister-in-law found a world-renowned surgeon, and this was back in 1997. So this was before the internet, right?
Right.
And I shouldn't say before the internet was widely adopted. So my family was not online. Many businesses were not online, but she was able to find this world-renowned physician, an amazing person. His name is Dr. Fred Epstein in New York. Um, and he specialized in these types of surgeries.
Right.
The issue, Leslie, is that
Different state.
well, different state, and B, we didn't even know how to get in touch with him. And so my cousin, who's a physician, said, well, I don't know him, but I know I have a colleague who lives in New York. I haven't really, spoken to him in a while, but I'll give him a call, see if he knows him. She calls her colleague, Leslie, she says, do you know this doctor? He says, not only do I know him, I'm having breakfast with him in the morning. I'll let him know.
That's
So,
that's when the stars align.
right, the stars align, but I do want to just point out this is all outside of a healthcare system. This is family and people working on behalf of a patient. This is not within a system.
Right.
So the doctor and my father speak. He says, Havertz, we've got to get these films to New York so I can just, look at them. And once he sees the films, he says she has to come out right now for this
Right.
surgery.
And let's make a note. At that time, you weren't emailing it over or putting it in a portal. So
Right.
that meant you had to put it in the mail
Oh, yes.
and get it from point A to point B because there
Exactly.
was no connective system,
Exactly.
which only works sometime even now, that the
Exactly.
doctor can go in and see or it can be transferred. And so that's time. And
Uh-huh.
time,
Uh-huh.
I'm assuming when you have something like this, it's not really on your side. You want to move as quickly and as efficiently as possible. And
Exactly.
again, this is not within the system. You have yet to try to get in back into a system.
Exactly. It is not within the system.
Right.
So we've got the doctor, that's where the physician who can do the surgery,
Mhm.
problem solved there. But then there's the other problem of how are we going to pay for this? because the insurance company did not want to pay for a doctor that was out of network. Now, keep in mind, we're talking about the spinal cord. There's a lot that could have gone wrong,
Right.
which would have led to more problems for the
Mhm.
insurance company had one of their doctors that was not as experienced. Like my doctor did like 200 of these surgeries a year, do the surgery. They didn't want to pay for it. We told doctor, they don't want to pay for it. He says, I will accept whatever fee they pay. So even if it's, less, he says, I can't do anything about the hospital fee, but my fee, I'll accept whatever. You just need to get out here to get the surgery. They still didn't want to pay for it. Leslie, my parents decided they were going to take out a loan against the house. And the very morning that my mother was going to the bank to sign the paperwork, the insurance company called and said they'd pay for the surgery.
Right.
Yeah.
Because let's be honest, most people in America, and I'm going to say America, and I'll speak about Europe from my experience,
Hmm.
will die in debt to the hospital,
Hmm.
to the
Hmm.
medical system that is supposed to be so advanced to save us. And I'm not knocking the medical system at all. I have amazing doctors. I love my doctors. I still go
Hmm.
back to New York for
Right.
all of my doctors. But the system for which they have to work through is the answer, is the issue for which we bump up against to heal ourselves.
Right, right. Exactly. And I'm so glad that you mentioned that. And that word is so important, system, because as a patient, we see the doctor and we think that the doctor represents the system, and we don't really appreciate, or at least I haven't always appreciated the fact that the doctor is working within the system.
Yes.
So it's a thing of where, well, I would love for my doctor, well, actually, this is not my case because I, have had a really good experience recently with doctors, but I have a friend scheduling an appointment on a healthcare app, 15-minute blocks. He could see the doctor for 15 minutes. That's it. So as a patient, it's very easy to say, oh, this doctor, this, that, the other. That's not the doctor doing the scheduling.
No.
That's the system behind the doctor that is, having them go from one patient to the
To the
next.
next, to the next. Even
And
trying
so,
to get in touch with doctors.
mhm,
If you have to change something, there's a full system now that my doctor is telling me about that's actually calling the patient. Oh, I see you haven't been there for a year, and kind of pressuring them to come back in.
mhm,
And which is good because you need to take care of your health. On another
mhm,
side, he's like, that's not my office calling. That's
mhm,
a
mhm,
whole nother system that they put in place to go through files and to call people.
mhm, mhm,
And
mhm,
so as we think, oh, that's great, they're calling. Is this a money grab? Do I know I need to go in? Is anyone even really looking at my chart?
mhm,
But to
mhm.
have your doctor say, oh, I didn't call you. You
Yeah,
know
everything
how
is
I call.
automated.
So there's
Yeah.
so much. There is a system that we just
Hmm.
aren't aware of that's
Hmm.
taking
Hmm.
place.
Yeah, and if I had to guess, I would say that the reminders are a good thing.
Mhm.
And I hear, and these are two separate points, but the reminders are a good thing for us as patients because that helps in terms of preventative care. We want to
Absolutely.
make sure that we're maintaining our care, but I will also say that the system and the insurance companies are motivated, the insurance companies are motivated to do that because they want you
Mhm.
to I will say they want you to be healthy, but they also want to catch problems early before they become very expensive.
And I love the word motivated. And
Hmm.
I'm all about the motivation. Please let me
Hmm.
remind people that they have to take care of themselves.
Right, right.
There can be more than one motive in, in that
Uh-huh.
motivation
Exactly.
to reach out to us.
Exactly.
But wow, it is just well, you answered beyond what makes you the expert, you could say. And because I want people to know not only is it a personal experience that you're coming from
Hmm.
that may have sparked the book, but you have such a serious background
Right,
on
right.
understanding. And even with all of that, you still had to work through a system.
We still had to work through the system, and the system, at least for me, did not end, at the surgery.
Mhm.
After the surgery, I was paralyzed from the waist down. Had to go through, I was in the hospital. I was in three different hospitals for 7 weeks. And
Wow.
so there's the whole point of getting better, right? Physically. But then there's this whole issue for me, at least, and this was again back in the 90s. I know that things are a little bit different now, but there's this whole idea of there was such an emphasis and a focus on the physical healing and really me just being alive that not one time were my fears, my emotional concerns, my mental health addressed. Leslie, not one time. I was, so young, 26 years old, and was literally told early on this could lead to death. I would go to sleep at night and struggle to stay awake because I was afraid I wasn't going to wake up in the morning. That's and don't get me wrong, that wasn't because of what the doctors told me. That was my mind just drifting, but the fact that I could die
Right.
made me afraid to go to sleep.
100%. So I don't know if you even know, I was a chaplain in the hospital. And so when people go into hospitals, or I know someone's doing something, I said, let me help you set yourself up.
Hmm. Hmm.
Ask for a chaplain. I don't care if you're religious or not. Ask for a chaplain because they still have to write things in their charts that they've seen you.
Hmm.
And on that fourth day, you want to speak to someone else that's not running in and out of your room, just period, to have a
Hmm.
conversation. Make sure you know who patient relations is when things
Hmm.
are good or when things are bad. These are all people that you want to have on your side. Who's the head nurse? Make sure you know who your nurses are. Build your other team outside of the doctors because you will need all of them at that time. And what you said, if I go in and I see someone wasn't maybe mentally there, I would go and say, maybe if the psychiatrist or someone has some time, they should stop by and say hello. That patient is struggling more than what I can do. And I would go and I'd be one more layer of someone saying, I
Hmm.
see someone is struggling. And I remember some of the nurses and even the doctors at one point would say, I envy you because
Hmm.
you can take time with the patients in different
Hmm.
ways than we can.
Hmm. Hmm. And I want to just go back to two roles that you had, the chaplain and the patient relations. And can you just talk about what that means in terms of documentation?
So, as a chaplain, I would come in and I would get a list of people that would say, I would like to see the chaplain.
Hmm.
And that could be any religion because that wasn't what it was about. It was about being able to give for me, a prayer or a blessing, sometimes just going in and saying hello. And that whatever my rounds, I had what was on the paper that people requested, but I also, when I would get to certain floors, the nurses or doctors would say, hey, can you pop in to see that patient? Better yet, the nurses or doctors sometimes will pull in, mainly nurses say, can I have a moment? Will you pray with me? I'm having a hard time with this. I'm having a hard day. So I took care of everyone. But when I went back into my office, I would chart. I saw this patient. They were not in the best space, or they asked for prayer. They were asking for additional things. They didn't understand the doctor. So I was able to get a nurse to come in and re explain it. And so I would do those types of things.
Hmm. Hmm.
Patient relations. Now, most people go to patient relations when something is wrong, and doctors do not want to be in a patient relations file. They just don't want to deal with that. But
Hmm.
if someone is really struggling and they don't feel like they're connecting with their doctors and they don't feel like they're getting the information, or they're having a hard time with billing, or they can't get through to someone in regards to, they're frustrated, they've been there, they're trying to transfer a loved one, whatever it is, death even, patient relations would call me and say, hey, will you walk with us to the morgue? I mean, or will you be with us? So we intertwine. They
Hmm.
also have to chart. Now, if a doctor's name gets charted many times in patient relations because someone's having issues, that becomes, when they have their meetings, that's part up in meetings.
Hmm. Hmm.
So I always say to someone, if you're really struggling that much, then go to patient relations. They are there to help you
Hmm.
through the system.
Hmm. Hmm. So if you want something on the record and you're not sure if it got on the record during your traditional interaction with your providers, speak to patient relations.
And don't run to them all like immediately. Try to work it out the best you can. But if you get to that point where you're just
Hmm.
like, no one's hearing me, I
Hmm.
am stuck. I don't know. I don't know what to do. I can't get all my doctors together. I can't do this. It's very hard to get 4 or 5 doctors if you have other. many things going on in
Mm-hmm.
one room together. Then patient relations will help facilitate that.
Right.
If they say something to me, I will go to the nurse, as well. But so
Mm-hmm.
I worked with their, the good thing about being a chaplain, I could work with everyone. And
Mm-hmm.
but I couldn't go grab a doctor and say, come in. But the
Mm-hmm.
doctors also knew I would say a blessing for them and for what they had to deal with and for the nurses. And that was always part of if a patient asked me for something, for a prayer or a blessing, I always added the doctors and nurses in because
Mm-hmm.
you have to work as a team.
Mm-hmm. Mm-hmm.
And it's very hard to feel that way, as you know, when you're laying there.
Right, right, right. And that's what I would say person-centered care, the idea of person-centered care brings the patient on the receiving side of care from the sideline and on to the team. And no, they're not writing prescriptions and diagnosing. They're
Right.
giving their expertise, which is
Mhm.
the context of their life.
Yes. Yes. And so I could hear those stories about people where
Mm-hmm.
the nurse or doctors could not because they
Mm-hmm.
didn't have that kind of time.
Mm-hmm.
And though
Mm-hmm.
I couldn't sit for an hour with someone either, people would open up. And I would sometimes say, like, we had a gentleman that would get dressed every morning, his hat, his thing, and sit on the sideline. And I would say that's cultural.
Mm-hmm.
An
Mm-hmm.
older black man is, especially his age, was you don't lay in bed. And
Mm-hmm.
so, but through conversation to him, I said, well, you do know you're not as well as you may think at this moment. That's why you're here. And it's okay. Like, give
Mm-hmm.
him permission to lay and let them take care of you.
Right, 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 right. That's fascinating.
And so it was that part that I was able to bring. That's why I was so fascinated with your book as well, because I do believe, though you have to advocate for yourself, you have to build that team and you have to understand who that person is
Mm-hmm.
and how they will heal.
Mm-hmm. 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 Yeah.
You know?
Yep.
So, wow. I mean, so after all you've been through, why did you have to write the book?
Well, this book has been in my head for 28 years.
Wow.
And there's so much happening with healthcare now, from the standpoint of policy, from affordability. And then I would also say people are frustrated. And it's hard sometimes when you are dealing with healthcare systems, essentially having a feeling, but not knowing what to do with that feeling. And with the book, I've got tons of recommendations. I have different frameworks for person-centered care. I have conversation starters. It's really an opportunity for people to channel their frustrations in a way that is productive and will get them closer to what it is that they want in terms of being empowered and working within the healthcare system.
I love that. So, in conversation starters, the thought would be you tell me, instead of saying, I read about this, this is how this pain is affecting me.
Right. The whole idea of conversation starters is to really think about your situation, and I've got conversation starters for patients, providers, and payers, and for you to reflect in terms of, hey, what's happening as this topic relates to me, and then what is it that I can do about it? And so the whole idea is to really start conversations, whether it's with yourself reflecting
Right.
or with other people, doctors and colleagues or, patients, but really to be able to have the questions and the discussion prompts to really be productive in terms of moving forward in care.
I love that. I have a doctor's appointment next week for my shoulder. And the entire time I have been speaking to myself about how I want to describe the pain
Oh,
because I don't want it to be brushed off. Oh, it's this. I want to say when this moves, it pulls here, it stretches here. And I've been having that conversation because I I don't, this is a new doctor, so I do not know them, and I don't know how much time I will get. And so I want to be very clear on what my symptoms are and what brought me in and how long it's been,
Mm-hmm.
and where do we go from there?
Mm-hmm. Mm-hmm. Mm-hmm.
You
Yeah.
know,
Let me ask you this. Are you able to communicate with your doctor in advance?
no, this is a new doctor.
Mm-hmm.
So that's why I know I need to be very clear.
Mm-hmm.
I have seen a different doctor in there for my hand before, and she was amazing.
Mm-hmm.
But she was also referred to me by someone that had surgery. That's what she
Right, right.
does.
Yeah, it's just so fascinating to me in terms of you've got these 15, 20-minute slots. Part of that is an interview. Part of it, you show up and you say, on a scale from 1 to 10, how's the pain? Do you smoke? How many times do you
Right.
drink? There's like all of these pre-questions. You go in and see the doctor, and that time is just so precious.
Yes.
I really wish that there were more opportunity to kind of like do the some pre-work in
Right.
terms of you being able to say in detail what it is that's ailing you. Then that way, when you come, even if the doctor didn't get a chance to look at it before, they see what is, your concerns are on the screen, read through them, and then answer question or ask questions that they have based on what you wrote, as opposed to them, first of all, having to do that data collection.
Right. Right. And I'm going to check to see if there's a data sheet because I can't stand going and filling out paperwork. I'm
Hmm. Hmm.
there. I want to go see a doctor. I want
Right, right,
I
right.
want to do that all in advance.
Hmm.
Now
Hmm.
I understand our seniors may not have that option to get on a computer and do that. And that's why I think there should be a 10-minute, please come. I know they say 15 minutes before, 10 minutes will be paperwork.
Hmm. Hmm.
And it doesn't count towards you seeing the doctor. You
Yeah,
know?
yeah, yeah, exactly, exactly.
But that's not, we are very much within systems that are not designed. How do I want to say this?
They're
Because
not optimized for people. They're
they're
optimized
not.
for processes, for
Yes.
their processes.
And that's where you may need a patient relations when you're trying to get through and understand billing and
Hmm.
understand why you can't get all your doctors in one room. If, like I said, if you have more than
Hmm.
one or two. My cousin was very sick and she had five different doctors, and one said they were going to take her foot because of diabetes, and one said, no, I can't take it because of your heart. The other one said, no, because of your. This one said, yes, take it. Everyone was giving her different things. I
Right.
show up, and this was before I even started working in the hospital system. I said, I show up and I demand I need all five doctors in a room. We're
Hmm.
going to do it now. We're going to plan it for tomorrow. No one's cutting anything until there's a better understanding on why two are saying yes and three are saying no. And there's no connection.
Yeah, yeah, yeah.
How do we get that connection if we're going to do process and procedures that all five doctors see everyone's notes?
Hmm. Hmm.
you know, see all the x-rays. It shouldn't be so separate. And I
Hmm.
mean, look, for if you are all within the same system, that is happening now. My chart, I love my chart where all my doctors are in one place.
Hmm.
But I purposely made sure I've kept, except for this new doctor, all my doctors in one line. But I don't have tons of doctors. I'm not ill.
Hmm. Hmm. Yeah.
And so how do we have the conversations? I mean, I have great doctors that have given me their cell numbers, knowing that I'm traveling in and out of state a lot. Hey, if there's an emergency, text me and let me know what's going on.
Hmm.
That's
Hmm.
rare.
Right, it is. Well, I am actually in the very early stages of working on an app that addresses those very topics that you're talking about so that we can increase clarity when it comes to what doctors are saying, but most importantly, what the patient wants to be able to convey and communicate. So, yeah, there's a huge, huge gap there. Oftentimes, you think about systems like my chart, amazing. I mean, access to information to manage your care is really, really important. But again, those systems are really optimized for workflow when it comes to providers.
Absolutely. Yeah, I look forward to the change. I mean, living in Europe, the health,
Oh,
I know, which is a
all
whole
right.
nother.
Now you look, now you're just bragging when you're
Look,
talking about living in Europe and healthcare.
it's just a different ballgame. You pay a lot in taxes, but I could go to every doctor and pay very little. I had my appendix taken out while I was in Paris. I had insurance there. I was living there and working there. I could have had the surgery done for free. I chose to have a private room with an American speaking doctor and American newspapers. And my boyfriend at the time, who's French, I wake up, he's eating lobster and having a wine and having his lovely dinner. I, the American newspapers. I paid $100 for a 3 day stay or a 2 day stay. That was it, only because I wanted a private
You
room.
can't even stay in a hotel for $100.
And now this was back in the 2000s, but still, I was very sick on tour. I stopped at a hospital. The lead singer of this rock band, who I was dancing with at the time, takes me, and all the doctor wanted to know, and I'm shoving my American insurance at him, like I have insurance, I have insurance. He's like, too much paperwork. All he wanted to know is how was this Black American girl and this rock star together and show up in the hospital together. That's all he cared about.
That
He's
is
like, too much
hilarious.
paperwork. You have an infection. It's okay. Take this medicine. Gave me the medicine.
Uh-huh.
Finish your tour. I know we're supposed to take care of those that walk in the door. How many hours do we have to wait?
Yeah, yeah, yeah.
When do we, and I'm sorry, when do we understand the system and know when we have to step out for humanity?
Yeah, and that's the challenge in terms of healthcare as a business here.
Mhm.
And how can we balance business with people's lives?
Yes,
And I think that we've got to do a better job of that because when you're talking about people's lives, it has to be more than just profits.
agreed. What's the three, four things that people should know? I mean, other than getting your book, because I think, and I'm not pushing the book, and it's so rare that I actually have people, I'm like, the book. But I think
Mhm,
it was the information was so clear
mhm,
and so understandable and digestible
mhm. Thank you.
for anyone that may have someone that is ill, that has been ill, that is trying to figure out the system, that maybe doesn't know how to communicate or advocate, or the insurance versus care, just how to bring that up. I think
Mhm,
having your book as a manual will really guide people because I think people are lost.
mhm. Thank you.
So, what's the top maybe three or four things that people should really think about?
So the first thing that, and I think that we've touched on these, but not concretely like what you're asking.
Mhm.
First of all, healthcare is a negotiation. It's
Okay.
it's a negotiation in terms of between you and your doctor. It's a negotiation in terms of systems, in terms of if, let's just say, the insurance company denies something. Well,
Mhm.
first of all, some of that's not even negotiation. Some of it, most denials from insurance companies are based on clerical errors. You know, they got your name wrong, they
The
put in
code,
wrong codes, yeah, something
codes.
like that, right? So first of all, make sure that you're going back and making or understanding why a decision was made so that you can make a correction. But it can still be a negotiation even if something is not covered. There's still opportunity to go back and forth. I'm not saying that you're going to get everything covered that you want, but I would say try. Also, payments are often a negotiation, whether it be a payment plan or the cost. So don't think of everything that you are given as final. Think about the word negotiation as you approach healthcare. I would
Mhm.
say the next thing is that context, your context really matters. When we think about healthcare, they're thinking about cases, but you're not just a case. You're a person. You're a human being. You don't live in a medical chart. You live in the real world. And so your real world context is really, really important when it comes to your health and when it comes to developing a plan that you will actually follow. You've got to set yourself up for success. So bring that context to the table. And then I would say the third thing, and we talked about this earlier, the importance of having a support system. And I know that can be really challenging for folks who have are used to doing things by themselves, um, and don't necessarily want to ask for help. But when it comes to your health, it's so important. And so having somebody come with you to an appointment, helping you make sense of information that's being provided by, taking notes. It might even be somebody who you have that's helping you understand, how to navigate insurance paperwork. It could be somebody who is helping to take you to, drive you to and from appointments. But bottom line is having that support system in place is critical. I've got to tell you, when I was sick and in the hospital, that part was easy for me in terms of having my family members really come in and advocate on my behalf. I was 26 years old. I didn't know anything. I do a lot better now given the age that I am. But what I will tell you that was very hard was, I was very sick. I had to have my most personal needs as a 26-year-old woman taken care of, who was paralyzed and bedridden, taken care of. Even when I got home, my father had to help me in terms of, getting me in and out of the shower. But at the end of the day, um, that support that you get from the people who are surrounding you, whether they be family, friends, or even when you're in the hospital, the caregivers in the hospital, is so important. I'm going to just add one kind of bonus thing.
Yes.
uh, if you are in a facility like a hospital or a rehab facility, one of the things that my family was sure to do was leave balloons and cards and candies. They wanted the staff to know that there are people. I had
Yes.
people for when
That
they
is
were not
very
around,
important.
and they'll be
That's
back
very
soon.
important.
And then also, they brought treats, not necessarily for me, but for the staff. So
Yes.
you have treats. People come in, they check in on you.
Mhm.
And honestly, my experience was great. I was surrounded by wonderful folks, so they would have come in anyway. But that's just a little tip in case you're interested.
I agree with that. That makes a difference. I always tell people, make sure, whether it's friends, anyone, have people coming in. When
Mhm,
they know
mhm.
people are coming in, they know that someone's watching. And it's
Yeah,
horrible to say that, but that's just the fact of
yeah,
it.
yeah, yeah.
When I was leaving my interim position as chaplain, and at the same time, I was doing all the branding and cultural work. So the cultural work really helped me because
Mhm,
I could
mhm,
have those conversations with nurses and doctors about this is the, this is happening because this is how they're used to working with doctors, or
mhm,
they're not understanding you. And a couple of doctors, when they found I was leaving, pulled me aside and they said, "Are you a mediator?" And I was
mhm.
like, "No." They're like, "Because we call you for everything. We don't even call you for a prayer blessing. We call you because somehow you can communicate between what we're saying and the family."
Mhm,
And
mhm,
that, and so if you happen to be in a hospital, see if there's a mediator, even if it gets to the
mhm,
point where you're
mhm.
just not understanding the breakdown. Because there are doctors that can break, I don't want to say protocol, it's not protocol, what they were taught how to deliver. And there are doctors that just, it's medical because
Mhm,
that's who they
mhm.
are. And they're brilliant, but they don't cross over to reach to the patient and
Yes.
see the patient to understand.
Yep. Yep.
And so it's okay to ask someone. And that's how I got it. There was a young son just blew up and was just like, my mother's 89. I don't know what you're saying to me.
Mhm,
Like, I
mhm,
don't understand you. Why is she
mhm,
still here? And I happened to be on the floor and was called, and I was able to calm him down and say, "Tell
Uh,
me what you need."
hmm
And then I
hmm
went to the doctor and I said, "He doesn't understand the medication and those things, what you're saying."
Right, right,
Help.
right.
I'm like, I don't know anything about medicine, or I'm not a doctor, I'm not a medical, but I can help translate what you're trying to get him to sign off on.
Right. And there are all of these issues, exactly like what you're describing, that happen in the medical, when we're thinking about the whole, ecosystem of healthcare, but there's no way to account for it, or there's no way to address it. So, like, I could definitely see why they would be interested in you being there to meet that very important need in terms of working with caregivers, helping people understand what in the world is going on. Those are real fears and concerns that people have. And you can't just not address them.
Right.
You can't just ignore them.
No, you can't. And, there are amazing doctors and nurses that are out there. There are systems that people are working within that they have found the best way to work through them
Mhm.
for their patients. This conversation is about being aware, having the knowledge when you step into that world that the system may not be for you, but
Mhm.
there's a way that you can get through it.
Yes, yes, yes.
Mm-hmm. So it has been amazing speaking to you. I could speak to you all day. We could go on. How can people find you? I know the book is behind you, but I think it is so important. I want everyone to see this.
Oh,
Your
thank you.
Pain Chronicles.
Shaping the future of healthcare through person-centered care.
Yes, yes, yes. Where can people find the book? Where can people find you?
So, sure, the book is on Amazon. And I will say that if you just don't have 24.99, you really want to read the book, let me know. But the book is on Amazon. My website, cynthiaoverton.com. I'm on LinkedIn, and I am starting to try to get Instagram together. I'm so not a social media person, but
You will be. You
I,
will
I
be.
I will be. So that would be at Clear King Chronicles on Instagram. I'm getting there. That's all I'll say.
You have so much to share, and it's so needed at this time, especially where we are, where people's just trying to figure it out when so many people don't have health care.
Yeah.
So going to a doctor, most of them will already be so sick that
hmm
they've waited for so long that
Yeah.
this will help them as a guideline on how to ask those questions when they're there, or to take someone with them,
Right.
to be their best advocate. I am so pleased that you are on the other side um, of your illness,
Thank you.
and that I have the opportunity to be here and to speak with you and to have you share all that, the
Thank you.
knowledge that you have.
Well, thanks for inviting me. I have really enjoyed this conversation. I really have had a great time, and I thank you for really doing the work that you're doing in terms of just helping folks. I mean, I think that, not just with me, but all the conversations that you have with folks on your podcast really go to serve to make the lives of your listeners and viewers better. So thank you for everything that you do.
Oh, well, thank you, Cynthia. I know I will speak to you again soon. To all my listeners and viewers, thank you. This is the Visibility Unlimited podcast. Visibility Unlimited Spotlight is the video portion. Continue to follow us, subscribe. I will see you soon. Check everything under the Cavu group and stay well. Thank you.